At the American Heart Association, we are a relentless force for a world of longer, healthier lives, and we educate and empower people to be active stewards of their own health and well-being. Devices that can fit on our wrist or in our pocket are changing how we capture meaningful health information. By engaging consumers in this effort, we are accelerating medical discovery. As part of our strategic relationship with Apple, earlier this week, we launched the Apple Heart and Movement Study in collaboration with Dr. Callum McRae and the Brigham and Women's Hospital. To learn more about this study and to participate yourself, download the Apple Research app from the App Store. Understanding the link between cardiovascular diseases and diabetes is the focus of our new strategically focused research network. Congratulations to these awardees and their institutions for being selected as part of the new network. Hopefully they're coming up. There they are. Thank you. I couldn't see them. They were behind me. The reason we fund strategically focused research networks is to make sure that specific areas of science that are critical to the American Heart Association's mission get the support they need. Sometimes those areas are newly emerging, such as cardio-oncology, which is so new that the term hardly existed when we first established strategically focused research networks earlier this decade. The risk of death from heart disease is 8 times higher in cancer survivors compared with the general population. We plan to change these outcomes with our $15 million commitment to this research. Look for an RFA this spring. Patients affected with structural heart disease need a new standard of care. It gives me great pleasure to announce that Edwards Lifesciences has committed $10 million to the American Heart Association to raise patient awareness and deepen engagement while improving the system of care through quality improvement programming. Together, we will improve the patient experience from symptom onset to just-in-time diagnosis, treatment, and management while delivering guideline-directed care and patient education. Thank you to the leadership of Edwards Lifesciences. As Dr. Harrington mentioned, the American Heart Association's Go Red for Women movement and Verily's Project Baseline have created Research Goes Red to empower more women to participate in scientific research. We're off to a great start as more than 22,000 women have already registered for Research Goes Red. Based upon their feedback, we've commissioned our Go Red for Women strategically focused research network directors to conduct an in-depth study on weight within the registry. I'm also pleased to announce new Research Goes Red grants to increase awareness and inspire action in cardiovascular disease detection and prevention in millennial women within underrepresented racial and ethnic groups. We will begin accepting those applications later today with awards announced in March. As cigarette use in the United States began spiraling down, eventually reaching an all-time low last year, Big Tobacco knew it needed a way to improve its bottom line. As we all know, they turned their attention to e-cigarettes. Now, vaping is the new smoking, especially among our youth. Let me put this in perspective. At the start of this decade, about 1 in 100 teens used e-cigarettes. These days, the ratio is upwards of 1 in 4. The tobacco industry is rapidly evolving its products and aggressively marketing new products to vulnerable audiences, including youth, communities of color, low income, and LGBTQ communities. Big Tobacco is doing everything in its power to hook the next generation on a lifetime of tobacco and nicotine with seemingly little care for how all of this will impact individuals, families, and communities. Well, we care. We care to the tune of $20 million. That's how much we're putting into researching the depths of this problem through the End the Lies Youth Vaping and Nicotine Research Initiative. There is no evidence to understand the long-term health effects of vaping and nicotine addiction on youth and adolescents. So let's create it. We're going to fund 2 or 3 scientists and their teams to work intensively over the next 2 years to provide the data we need to help stem this tide. This is part of our triple threat strategy against the growing entity of big vape. In addition to trusted science and research, we're also coming after them with unrelenting advocacy and community action. By leveraging our nationwide and very significant school footprint and by leading national and local policy, we will activate parents, educators, superintendents, school nurses, youth, and elected officials to put an end to this epidemic. No matter what country you are from, vaping should be a concern to you. Kaiser Permanente shares our grave concern for the toll this growing epidemic is taking on our youth and communities. This weekend, they announced a significant commitment to the American Heart Association to create the Preventing Youth Nicotine Addiction Policy Fund. Powerful collaborations such as this are essential to creating change. We again acknowledge Dr. Regina Benjamin, former U.S. Surgeon General and a board member for Kaiser Permanente and for the AHA, who is here in the audience today. Thank you, Kaiser Permanente, for this significant commitment. As you have likely heard, just this weekend, our important strategic partner, Apple, has pulled all vaping-related apps from the App Store. We applaud them for standing with us and putting a stake in the ground against big vape. We have been talking about the impact of vaping on youth. It is time to hear from some teenagers. Representing these voices and millions of their peers is Caitlin Quesada, a high school junior from Los Angeles. Caitlin, come on up. Caitlin was in the 6th grade when friends encouraged her to try flavored e-cigarettes. At first, she didn't understand all of the pushback by grown-ups. Then she learned better. She became a powerful voice in her community, and she is here with us today, and she has something to say. And we're going to let all her friends join her before she gets started. All right, Caitlin, let's hear what you have to say.
Hello, my name is Caitlin Quesada, and I am a junior at Animo Oscar de Loya Charter High School in Los Angeles, California. My generation was literally supposed to be the first generation not addicted to nicotine. But then vaping came along and everything changed. Well, I stand here today to deliver an open letter to Big Vape with my peers from Philadelphia. Dear Big Vape, not sure if you're aware, but lying is bad. And you've been lying for a long time. You say vaping isn't smoking, but the nicotine in one pod equals an entire pack of cigarettes. You say you're not big tobacco, but the tobacco giant that makes Marlboro cigarettes owns 35% of the largest e-cigarette makers. You say you're not marketing to teens, but your flavors say otherwise. So let us school you on the dangers of lying. Lying leads to nicotine addiction. Lying leads more people to smoking. Lying is producing lung disease, heart disease, and cancer. Lying has landed hundreds of e-cigarette users in hospitals. Those are the facts. And the fact is, lying kills. It's obvious to teachers, school administrators, parents, the American Heart Association, and especially students, that vaping is a life or death health threat. But the bigger epidemic in this country is even more sinister. You're lying. Quit lying. Everyone in this room, take out your phones and post your commitment to the cause by tweeting, "Hey Big Vape," hashtag quit lying. Our movement begins here today in Philadelphia. Will you be the first to join us? Our lives are at stake.
Thank you to Caitlin and to all of these remarkable young people who have had enough of the tobacco industry taking advantage of them and their youth. And yes, they deserve a standing ovation. Also joining us in this movement is our longtime youth health and wellness partner, the National Football League, which will use its voice to help reach millions in this fight to keep kids safe. Visit quitlying.org to sign the open letter, get social media content, and access the wealth of other assets to empower Caitlin, the teens of Philadelphia, and all of America's youth. We urge you to join the conversation at hashtag quitlying. We need to hear from you now. The health of an entire generation may depend on it. And that, my friends, is what it means to be a relentless force. Thank you.